Hello, everyone. It's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to answer a question. Why does my arthritis feel so bad when it's cold or rainy outside? Why is the weather making my arthritis so miserable? Well, you're not crazy. I hear a lot of patients say this, and I don't know if you've really been validated because there's not really much to do about the weather because I can't change that. But what is happening is the change in atmospheric pressure is affecting your joints. So when the atmospheric pressure lowers or falls, the air thins and can become more windy or cooler, and this makes your joints more susceptible to the pain. I like to liken it to our teeth. So we have enamel protecting our teeth, and when this enamel wears down or is damaged in any way, or the integrity of it is compromised, our teeth become more sensitive. So people have cold and heat sensitivity in their teeth when their enamel is weak, or there's some injury or trauma to the tooth, and you have a really bad toothache, and it's really deep, achy pain, like those nerves are being hit every time that cold thing hits those teeth. So think of a toothache in your joints. When you think of arthritic pain, it's really not pleasant. So I hear you, and I feel you suffering with arthritic pain, but you're not crazy. We are actually very connected to this world around us, and the changes in weather can affect your joints. So just know that. Now, regarding arthritis, and I'm talking today about osteoarthritis, there are some things to do to help treat arthritis. So I'm going to talk a little bit about that. So let's first define osteoarthritis. It's basically a degenerative disease to your joints. Now, the cartilage is the protective covering of our bone, like our enamel protects our teeth. Hope that helps explain it a little better. And this coating kind of acts as a buffer between two bones. So we have our femur up top and then our tibial below if we're looking at our knee joint. And we have cartilage covering the bony surface, and then there's some synovial fluid and lubricant in between those joints. So when we jump or when we move or we pivot, those bones aren't grinding on each other. But when we have arthritis and the cartilage is broken down and it's damaged, the space gets smaller and smaller and smaller, and when you reach a point of severe osteoarthritis, these bones are touching, and you are just feeling that grinding and pain every time you try to move. Now, osteoarthritis does develop with age because the volume of our cartilage lessens with age. Now, there are some things to do to help you if you have arthritis and severe pain from your arthritis. So I'm going to do the non-pharmaceutical stuff first. So exercise, number one. I know you hurt and you feel sometimes like, if I move, this is just going to hurt more. But moving actually improves symptoms of arthritis. If you just endure it a little bit through the pain and start to become more mobile, because the more stiff we keep our joints, the worse arthritis can become. So you want to mobilize yourself and do exercises that maybe are not high pressure, like intense jumping or running, because you're just kind of pounding those bones. Now, I'm not saying running and jumping or like basketball isn't good activity. I'm a runner, but when you have severe arthritis, there's things you try to avoid so that you don't aggravate it. But definitely low impact activity like swimming. You can actually do some simulated running or jumping activities in a pool, and the buoyancy of the water will take a lot of that pressure off. So that's just one example. Biking as well. Also, you want to do physical therapy. So for instance, with knee osteoarthritis, you want to strengthen those quadriceps muscles. That's the muscle in the front of your thigh because that is a muscle that helps to offload the joint, because with tension on the bone, it supports the joint and it helps to offload some of that pressure. And we need the strength in those quadriceps to stand and to help us with our balance. So work on your quadriceps if you have knee osteoarthritis. Now, osteoarthritis affects the joints, mainly the shoulders, the hips, the knees, and the fingers, specifically the DIP, which I'm wiggling here at the end of my finger, and the PIP joints, which can cause a lot of hand pain and difficulty with fine motor skills. So you want to do hand exercises. Now you also can apply warmth to the joint. Castor oil warmed is actually very soothing to the joints. So you can soak a cloth or a thin towel in castor oil and then wrap the joint with that for 20 to 30 minutes. Maybe try that in the morning before you start your activity, just to help get that joint a little loosened. Now, the correlation with the weather as well, when it comes to cold weather, is hypothesized that the cold weather thickens the fluid in that joint space that I talked about, and it adds the stiffness. And the pain part of it, you can just think of, like I mentioned with the enamel, you know, that analogy. The cartilage is like a protective coating of the bone. So if that cartilage is worn out from arthritis, your bone is lacking some protection or buffer or covering that it had before. So it's more exposed, like a tooth is more exposed when there's a cavity or the enamel is worn out. So I hope that helps. Now, other things to do besides the non-pharmaceutical stuff I mentioned, diet is always also an important aspect of our health. And you want to avoid inflammatory foods. So processed foods tend to have more inflammatory properties, which can exacerbate arthritis. Also, actually, there's a juicing recipe that I have on a prior post that you can take a look at, because you can blend some things together that are really good for stopping inflammation, sucking out that lactic acid that causes a lot of that pain and muscle soreness, and drink it maybe 3 times a week, and that can help a lot as well. And make sure you're hydrating with a lot of water. You want to try to drink 2 liters of water a day. That just helps to clean out and flush out our system and keep us hydrated, because dehydrated joints also are achy joints. Okay, now when it comes to pharmaceutical things for pain, obviously there's Tylenol and non-steroidal anti-inflammatories like ibuprofen, Advil, naproxen, or Aleve, and those things. But you always want to take those under the supervision and direction of a physician, because every medication can have side effects, and you want to make sure you don't have any underlying conditions that would make it risky for you to take those things. Then the next line of medications include topical things like lidocaine patches, or topical agents like creams like Voltaren gel. You can do over-the-counter creams, Aspercreme, Bengay, Icy Hot. There's a whole list of them. So those are your options there. Then you can also try injections. And these just help to add some lubrication in that joint space that I was talking about. So you can do steroid injections, which also decrease inflammation, or hyaluronic acid injections. There's also platelet-rich plasma, which is a newer form of treatment, but has proven helpful in some people. Now, the next thing is surgery. That's always the last result. As a physical medicine and rehab doctor, we always aim to improve whatever ailment you're dealing with the least invasive thing possible, to help your body recover and heal on its own. But in some cases, arthritis is so severe that surgery is necessary and appropriate. So that would be another option as well. And I am going to put a little more detail in the comments. I just don't want to exhaust you with talking too long on this video, but I hope these were some helpful tips. And if you have any suggestions on what helps your arthritis, leave it in the comments. And if you are somebody who is suffering from severe debility due to arthritis and would love to work with a physician who will help you achieve increased mobility, function, independence, and quality of life, I invite you to book an appointment at freedomwellnessphysiatry.com. Physiatry is spelled Physiatry, and join me in starting your journey to living better. I hope you have a great day, and I'll see you next time. Bye-bye.